Okay. How can healthcare providers effectively communicate the complex interplay between autoimmune diseases and fertility to patients?
Ooh. So healthcare is science,
It
right?
is.
And so I have a lot of amazing colleagues who have modeled how to do this well. Um, it- it's an art, okay, communicating the impact of fertility in a medical diagnosis. It's an art. You got to blend it with science, and you got to put some humanity on it. That's how I think about it. Right. So you got to give the facts, right?
Yeah.
You have to what we call inform, right? So a patient can make an an informed decision, right, with all the information that they have. But equally, it's important to still remember the humanity in it, and knowing that just one medical diagnosis can really kind of push somebody over the edge from an emotional standpoint. But then when you add on another diagnosis, particularly something like fertility, which is incredibly stigmatized in our society across, and I've seen this across race, across age, across economic status, across religions, that we also as providers have to make sure that we are checking in with our patients to seeing how they're doing emotionally,
Mm.
as simple as how are you coping with this. And if a patient is saying I'm having a really hard time, then you refer that patient to somebody like me, Dr. E.
Okay, Dr. E. So, question: have you seen any patients get pushed over the edge, and if so, like, what does that look like?
Ooh, everybody has a crash out point.
They do.
I mean, everybody has a crash out point. And that can look really different depending on someone's history, what their current situation is. Um, I mean, yes, I've seen people crash out.
Were you like, did you fear for your life? Like, did you, or they was just
Yeah,
yelling?
no, the crash outs usually aren't directed towards me.
Okay.
I usually hear about the crash out or I witness the crash out in my session with them because they're talking to me about their frustrations. But I always tell my patients, and this is just who I am as a person, when you come in to see me, it's a safe place.
Hmm.
And so if you feel like you need to crash out, I literally tell my patients, okay, I'm not gonna tell you not to crash out, but can we find a way for you to crash out with the minimal amount of consequences? Right. And so, like, sometimes I'll have patients who are really, really upset with their medical provider for reasons that I may or may not agree with, that they're upset. But I'm like, okay, so you're upset about maybe your IVF cycle didn't go the way you planned, or you thought you had an appointment, they had to whatever the issue may be. Well, let's talk about how you can assertively communicate that to your provider.
And your voices sound like real calming. So, do
Yeah.
they normally take to your voice? Because I would take to your voice.
Yeah. And if they don't, I I have I work with some amazing individuals, like my patients are just very dynamic individuals. And I respect them and I give them respect and I hold them in a high regard because I see them and I see their humanity. And I think with my approach, it's reciprocal.
Okay.
To the point where like my patients don't even always call me Dr. E or Dr. McKinney. Someone called me, saw a patient in the hallway today. Hey, Erica. I was like, hey, and went on about
Dang.
my business. Right. It's like, you don't have to call me a doctor. I know I'm a doctor. You know, I'm a doctor. What can I do to serve you today? What can I do to help you? Um, so I think because I approach my patients like that, if they getting ready to go to that other way, I'm like, hey, let's come on back because we don't do that over here. Not in my office. Now you may do that with, whoever else, but we don't do that. This is a safe place. And we don't do that here.
That's amazing. That's dope.
Mhm.
That's dope that they can take to you and calm down and think twice. Like,
Mhm.
because you do have that calm and
Or
soothing type
think
of
four
voice.
times, five times. Bring it on back.
Breathe.
Breathe.
Okay.
Take a deep breath.